Okay, our final speaker on this panel is Jean Slutsky, whom you've heard from a little bit. She's the Chief Engagement and Dissemination Officer at PCOR, and we look forward to her talk.
Thank you. There's a big gap back here, and once I was on a panel, and you know how guys always sit back in their chair, and he just like went over and his legs came up, and it took us like 5 seconds before one of us said, I wonder if he's okay. So that's why we gave each other a good berth there. So I'm really pleased to be here. As Kay May, I always call her Tatty, so I have to call you Tatty, Kay. We spent a good portion of our career crossing paths, and Q is one way that we have, but even before that, serving on clinical practice guidelines as either a methodologist or an oversight. So I've ended I'm not ending my career. I've made a career shift to PCOR, which is a Patient-Centered Outcomes Research Institute. You've seen this slide from a previous speaker, but I wanted to put it up because of the second paragraph about the dissemination of research findings. This is actually a really unique piece of legislation in that it talks a lot about the involvement of stakeholders throughout the research process, but also in the dissemination and implementation of research findings, which brings everything full circle. If you look at PCOR's missions and strategic goals, the second one is to speed the implementation and use of patient-centered outcomes research. And the third is actually to influence the research of others, which I think is very forward-thinking of the board in the early days to make sure that we're just not an institute that's in isolation, but we actually affect the environment around us. So how many of you remember who Carl Sagan was? Oh, that's really good, because, you know, young people, how many know who Johnny Carson is? All right. So how many of you remember seeing Carl Sagan on Johnny Carson? Okay, that's where we get the oldsters from the youngsters. So there is actually something in the sociology literature called the Sagan effect. And what it talks about is that one of the most frequently cited reasons for scientists to be reluctant to talk to the press is called the Carl Sagan effect. So he was really criticized for doing things like going on Johnny Carson. He was an astronomist, and spending so much time communicating with the public. And he actually lost tenure at Harvard University because he was thought to be a populist and not spending enough time being a scientist. Well, talking about published or perished, throughout his career, he averaged a scientific peer-reviewed paper per month, which is pretty amazing. So in fact, he was a very prolific scientist, but was actually hurt because he brought science to the public in really understandable and meaningful ways. I use this example because to me it really shows how there are so many perverse incentives to getting evidence into the hands of people who are not researchers. So if you look at this, this shows how PCOR actually takes stakeholders' input into what we call the virtuous circle, which is topic selection and research prioritization, proposal review, as well as the design and conduct of the research, which feeds into dissemination and implementation of results. This follows the well-known adage that if you're not asking a question that people want to have the answer to, and you're not looking at outcomes that are important to people, they're not going to use that evidence because it's going to be like, you know, ships in the night. There's going to be no sweet spot there. So, you know, and this is actually takes it down another notch where you look at how do you actually take that evidence once it's coming out of a research project. You have to look at the evidence, see how strong it is, understand who are the best communicators about the evidence, make sure you get the evidence available in many different ways so you can speak to a lot of different audiences, make sure that you can support the adoption, so make it easy to adopt, and then make sure that you're doing it right so you can evaluate what worked and what didn't. So if you look at Carl Sagan again, and I think this is particularly important today, is that our species needs and deserves a citizenry with minds wide awake and basic understanding of how the world works. And, you know, we're in a bit of an anti-science mode here, and I think we have to recognize that science is not our enemy, but actually it's our partner in making decisions about what works, what will work for us individually, what will work for us as a public, and what will make our lives better and what will make our lives worse. So I just wanted to spend a few minutes talking about the legislation that makes what PCOR does so unique. So we're mandated to do public reporting of all of our research findings. So I don't know of any research agency that is held to this standard where we must post results on clinicaltrials.gov before even submitting a draft report. The findings have to be posted to PCOR.org within 90 days of our acceptance of the final research report in both a 500-word public abstract and a 500-word professional abstract. What's unique about those abstracts is it has to cover issues like how does the research affect different populations? What are the limitations of the research? Were there any conflicts of interest? And then, of course, the research findings. So we've established a translation center that's been charged with developing these and other products to meet the goals of developing comprehensible and accessible reporting of research findings. So this has to happen with every single piece of research that we fund. So we actually did cognitive testing of these templates to make sure that they were useful to the different audiences that would be using the research findings. We cognitively tested them with patients and consumers and clinicians and other stakeholders. And so this is in the blue box, that's the process that the board adopted that will create standardized summaries of the study results for patients and the general public, which will address the following specific provisions of the law: convey the findings of research in a manner that is comprehensible and useful to patients and providers in making healthcare decisions. This just gives you an idea of what this will look like. This happens to be a study that looked at kids that have a bone infection called osteomyelitis, where traditionally these children have been treated with a line that goes into one of their arteries that delivers high-dose antibiotics. So I don't know how many of you have young kids, because this is a condition that usually hits kids at their most active age, like 7 to 14. And, you know, they pull it out, they get clots, they end up back in the hospital. So this study actually compared kids getting the what's called a PICC line, where it's delivered that way, versus children that got oral antibiotics at a high dose. And in fact, those kids did just as well, but ended back in the hospital much less. Creating this information for parents and clinicians is very important. We also require that all PCOR awardees must deposit their manuscripts to PubMed Central so they are available to all. And because we want to make sure that people can get access to the original journal article, awardees or PIs may request that PCOR work with the journal, accepting their manuscript to cover fees to bring that journal article out of the firewall of the journal. So we'll pay open access fees, cover charges up to $3,500 per project. These are applied to the primary findings in peer-reviewed journals. And we've only accepted 10, but we haven't had very many results come out yet. Interestingly enough, we're the ones that are negotiating with their journals, so we have the power of a large number. So if we had individual PIs negotiating with the journals, we don't think we'd get as good a deal. So PCOR is actually doing the negotiation, and I have this woman on my staff who's gotten pretty good at negotiating with top-tier journals. So it's so far, we're very successful. So I just want to thank you and just add a personal note. When I was listening to our first speaker, I started my career working under a Robert Wood Johnson Healthcare for the Homeless grant at the LA Free Clinic in the mid-'80s. And it was like being in a war zone. So it's really amazing to see how far we've come. But I think it's important for us to stay vigilant. Thank you.